It's a little long.
Well, Al, I'm Montoya. I am so happy to have you today on my show, Stories Worth Telling. And the story behind my story, I don't know if I mentioned this to you, is that my mother at 92 years old didn't think she made a difference in her life. And she was a public school teacher and private school teacher too as well, taught thousands of kids, and I was in shock. So my mission is to help people understand and underscore the importance of their lives and tell the stories that go with your life. So thank you so much for being here today. I'm really honored to have you as the Director of Services for Veteran Affairs in West Hartford, is that correct?
In West Haven.
West Haven,
Yeah.
okay, West Haven. So here you are today, and I'm really pleased to have you as a guest. You previously served in the military, and you were part of the Air Force.
That is correct. Yep, I was a Russian cryptologic linguist, believe it or not.
I love that. Yeah. Well, that's pretty amazing. And cryptology is interesting, and I think linguistics is really interesting. Both of those topics. Then put Russian on top of that. That would make it triple trifecta, right?
That is correct.
Oh, well, very good. So, do you want to tell me a little bit about your history and how
Sure.
you got involved in the military?
Sure. So I grew up in a very small town in Wyoming, actually, right outside of Laramie, Wyoming, so Centennial, Wyoming, and graduated after quite a bit of ride there. Ended up moving to the West Coast, where I graduated high school, and immediately out of graduating high school, I decided I wanted to make a difference, and so I ended up joining the Air Force as a Russian cryptologic linguist, and spent 10 and a half years there as part of my career.
In Russia?
No, so I was stationed all over the country.
Okay.
The latter part of my career, I was able to sit on the back of a C-130 and be able to do some jamming and beaconing.
Nice, very nice, yeah. So you must have learned the language.
I did, yeah. So for part of my career, I was able to go to Monterey, California, where they taught me how to learn to read, write, and speak Russian. So I still know a few words now. But it was a great opportunity to really understand a different language.
Pожалуйста, right?
Не за что.
Very good.
Yeah.
Okay, so that's where you started, and then you are currently in Connecticut working, and you have a big job. Do you want to tell us a little bit about your job as the Director of Veteran Affairs?
Absolutely. Yeah, so as the Medical Center Director, the CEO of VA Connecticut Healthcare System, I am responsible for the healthcare delivery for all of the veterans within the state of Connecticut. And we do that through about 3,000 employees. Our West Haven campus is a full-service hospital. We have our Newington operations, which does Monday through Friday outpatient care, as well as our 6 community-based outpatient clinics across the state. So really happy to be able to get out there in the community and to be within 30 miles of any veteran for primary care services.
And that's amazing. That's 3,000 employees, and how many veterans would that be that you'd be servicing? Do you have an idea what the number of that would be?
So we take care of about 60,000 veterans within the state of Connecticut, and we're always bringing, out there, encouraging more and more veterans to join the system. Right, so we offer, primary care, mental health care, specialty care, the full gamut that you can imagine for healthcare for veterans.
So you as a veteran, do you access those services? Is that something that is part of what you do, or
I do.
you go to a private practice?
Yeah, so as you mentioned, I am an Air Force veteran. I was medically separated in 1998.
Okay.
And a part of that medical separation is the ability to be able to access care within the VA. And so, I am married. I have 3 kids. My wife is a state employee. We have great state insurance. But I have always decided to use VA as my own personal health care. And it is something that I'm very proud to do. And something, whether it's, through my hearing aids, right, as part of my disability, or going all the way up to a CPAP machine and everywhere in between, I utilize the VA healthcare because I believe in it. I believe it can make a difference, and I believe that there are always opportunities for improvement.
Oh, good. Well, that's a real strong testimony for the services that you're providing and for the work that you're doing, if you're actually using those services.
Absolutely.
Yeah, and availing those. And how do you find the services when you get there?
Yeah, so I think they're amazing, right? As I mentioned, we have 3,000 employees across the state. And every single day, I feel so fortunate to be able to lead this great organization. We're really striving to become the best place to work, right? And to engage our employees. And what I know is that when those employees are engaged and they feel valued as part of the team, that on the other end, that veteran is going to get absolutely phenomenal medical care, right? Now, are there going to be opportunities where we have to improve? Absolutely.
Of course.
Just like every healthcare system. But I think that we provide world-class health care to the veterans who are in the state of Connecticut and those that come to us for that care outside the state as well. But I'm proud every single day, as I mentioned, to be the leader of this organization and to provide top world-class quality care.
Well, thank you for that. And thank you for your service, too.
Thank you.
And Brian Burridge, our Veteran Affairs liaison in East Lyme, always says that I need to ask, are you getting the services that you were provided? And I'm sure that you are. But that's a question that we need to ask every single veteran.
You know, it is. And I think, why I try and get out to the coffee houses, why I try and get out in the community. I actually just was at a community event today. Is really to encourage my fellow brothers and sisters, right, to utilize VA care if they're not using that already. The more veterans that we see, the more veterans that we have come into our system, the larger budget that we have to be able to continue taking care of those veterans.
And the better the program will evolve, it will improve.
Absolutely.
Okay.
Yeah, so a very, very good example of this is our new clinic that's soon to open in New London. Because of the growth of that clinic. That's our second largest clinic, community-based outpatient clinic behind Newington. Because of the growth of that clinic, we're going from 5,000 square feet up to 15,000 square feet and adding services like phlebotomy, specialty care, different things that we wouldn't normally have in a clinic because we're bringing more veterans in, right?
Nice.
And so when that opportunity opens up, it really just is a blessing for those veterans in that community to not have to drive to one of our larger sites to get that care.
Well, access of services is just as important as the service itself, I think. So what are some of the struggles that you have with providing for some of your veterans, reaching to some of the veterans who may not be availing themselves of the services that you provide? What else are issues that you'd like to address or improve?
Yeah, so I think when you look at a state like Connecticut that has different parts that are rural, right, how do you access or deliver that access to care to those veterans in the rural parts of the community? And, one example of this, obviously, as we're coming out of the pandemic, we had the opportunity to go and deliver vaccine to veterans across the state. And
Nice.
really, really proud of the work that we've done with that because, we've delivered the vaccine to over 25,000 veterans,
That's
right?
amazing.
And we set our goal at 70% of the veterans that we serve, and we're actually just about 70% of the way
Well,
there.
congratulations.
Yeah, thank you. And I think that example is, we actually ran a vaccine clinic up in Putnam.
Nice.
And talk about one of the most rural parts of our state.
It really is pretty, isn't it?
I'll always remember this conversation with a veteran up there. He said, Al, it takes me 25 minutes, 30 minutes just to get down to Willimantic. And so you have to really take that into account, right? Our closest clinic to Putnam is Willimantic. So how do you make sure to bring that care to the veteran? And what does that look like, right? And so I think it really helps push the limits of partnership, right? And the realization that it's not just the VA that's going to take care of veterans. It's the community as well, right? And those other partnering organizations.
Right. So who could you partner with? So what are some options along that line? Other smaller clinics, or what are some ideas that you've generated along that line?
Yeah, so I think I'm really glad that you asked that question because we just were at a grand opening for the Eastern Connecticut Veterans Community Center, right? So this is a phenomenal organization that's run up out of Wyndham. It's actually right next door to our clinic, and this is run by the community. They have a space where they run a coffee house out of there. They have space where they bring in different organizations to help partner and help provide services to our veterans. And it really is that linkage, right, to a community, a village taking care of veterans. If you rewind a little bit back in the history of the VA, we've always thought of ourselves as being the only organization that can take care of veterans. We have to crack that code, right? You have to partner with the community as that community center that I just mentioned, and not be afraid of it, right? And I think that's one example of just another service now that's open to veterans. And as we're seeing younger veterans come in as well, you have to kind of be a little innovative like that.
Is there a demographic that you think is reluctant to use your services? Is it younger veterans or maybe older? I don't know. Is there a group that you think is reluctant?
You know, I think that there is, and you know, when we look at this, our Vietnam vets, obviously because of what they had to go through, you know, some of them are reluctant to come in. So it's getting out to those coffee houses, it's getting out in the community, it's giving out my cell phone number when I talk at these community events, to really offer that hand, right? To say, here, you know, from one veteran to another, let me help you get into the system.
Right.
Let me help you navigate that. The second group, I think, is our younger veterans, right? I am a younger veteran. I'm not the youngest one, right? I am 42, but I think that works in my advantage to really encourage those younger vets that this isn't the same VA that your father used or your grandfather used. And to really have that conversation, and that's why I really appreciate getting out in the community and doing that.
Well, you're doing the work, and you're getting people to understand what you're trying to do and what you are doing and what you're trying to accomplish. And you said partnership, but I'm also wondering about telehealth. Is that something that's not really viable because of the infrastructure? Tell me about that.
Yeah, so I think it is in some locations, right?
Depends, right.
You know, as we look at what happened during the pandemic, you know, essentially every facility was closing their doors to non-emergency procedures. You know, we really had to think about how do we very quickly deliver and deploy telehealth to our veterans. And, you know, we've been fortunate to be able to do that as a system using either phone care, VA Video Connect, right, or face-to-face appointments. So never did we stop, right, during the pandemic having face-to-face appointments. We were still bringing veterans in. We still had staff coming in. But we were also able to deploy staff to their homes to keep them safe.
Nice.
So much so that, you know, we had one of the lowest infection rates amongst our staff in the country because they were at home being safe and we were bringing in only emergency care.
Sure.
So when you deploy that telehealth, you know, there's things that you have to think about. You have to think about the broadband, right? You have to think about, you know, some of our veterans don't necessarily know how to use it.
Right.
Right? My grandparents are 84 and 85. And they just learned how to use an iPad during the pandemic, and you know, so it's that group where we have to help them along, right? But then still keep our doors open to be able to take care of them.
Well, I really appreciate that work that you're doing and getting people and teaching them and showing them that there are different avenues to access the services. And I heard that telehealth was actually pretty good when it came to certain things, like just the conversations people were having during therapy services. Sometimes it was just as effective. Now, you told me that there's a crisis intervention line. Tell me about that.
Yeah, so I think it's important, and you know, the Veterans Crisis Line is one way that our vets who you may be thinking about suicide or maybe having a mental health crisis can reach out and really seek that help, right? And that number is 1-800-273-8255. Again, it's 1-800-273-8255. And that puts our veterans in direct contact with someone to be able to help them navigate that system. I also, as I mentioned, I give out my cell phone number, right? And that number is 203-500-2983. Oftentimes, I talk with vets and they say, "Oh my gosh, I can't believe you just gave out your cell phone number." And I said, "Yeah, why wouldn't I? Why wouldn't I be that connection?" And you know, I learned very early on in my VA career when I went up to White River Junction, Vermont, as their medical center director. I gave out my cell phone number, and as I transitioned from Connecticut to Vermont, I actually had that phone go off. And I picked it up, and I couldn't hear who was talking on the other end, but I could hear a conversation happening. And as I took a moment and listened even more intently, what I heard on the other line was a veteran who was going through the process of completing suicide.
Oh dear.
And because of that connection of giving out my cell phone number, I was able to connect them to a team of individuals who were able to save that veteran's life.
Wow.
That's the power of giving out that cell phone number.
Right.
And you know, while you know, if I don't answer it right away, I make those connections. I do text. Right, I have 3 kids, as I mentioned, who don't talk on phones. They text only, almost exclusively, right? And so having that connection, that lifeline, is a bridge into the Veterans Healthcare Administration, and so I'm happy to do that.
Oh, that's amazing. Well, you give so much of yourself and the work that you're doing and what you're providing for other people, so I really appreciate that.
Of course.
And how are things going as far as the crisis now that the pandemic has I don't know. I'm afraid, actually, that we might have a resurgence. I mean, we've had 8,000 deaths in our state, is what I read this morning, 600,000 across the country. I mean, it was a big deal. And now you and I are both vaccinated, so we're not wearing a mask. But there's a lot of people, and we're entrusting ourselves to a lot of people by being in relationships with them, not knowing if they're masked or not masked. So are you afraid that there might be a resurgence? What's your opinion on that?
You know, so I'm also hesitant, just like you. In fact, every time I say we're close to ending the pandemic, I knock on wood or something. But I'm just very thankful for the miracle of science to be able to develop a vaccine so quickly to be able to combat the COVID-19 virus. And you know, this was our mission for our 3,000 employees, to get it out as fast as we could. And as I mentioned, you know, we vaccinated over 25,000 of our veterans. We, you know, VA Connecticut has vaccinated 90% of their staff.
That's amazing.
Right, and so really, really pushing the limits on this, because we know that it does make an impact, right? And we see the data shows that the infection rate does go down, right? The severity of the disease does go down if you are vaccinated. And so we now, instead of having mass vaccination clinics, we give the vaccine in all of our clinics on a walk-in basis.
Oh, nice.
You know, we've been very fortunate ever since December 15th to roll out Pfizer, Moderna, and Johnson & Johnson.
Nice.
So there are options for our veterans to be able to get it. And so I am hopeful, and I think that we've seen it over the last month, where the mask mandates in some cases have been eased, that you're seeing that connection between people come back alive, that spark. You're meeting people for the first time that you haven't seen without a mask.
Exactly.
And you're saying, this is really, really great. But I think we're also keeping in the back of our minds that we need to make sure that we're washing our hands, practicing, you know, proper hygiene, you know, making sure that if you're in a crowded area that's not outside, that you're wearing a mask, you know, or if you don't feel comfortable wearing a mask, and just keeping that distance as we're hopefully awaiting what the fall looks like. And I think it is one of the great things, you know, having that hope and that connection, because it has been sorely missed over the last year and a half.
Absolutely, absolutely. And how are people doing, you think, post-pandemic? How are your veterans? How is your staff?
Yeah.
I think there's a lot of fatigue. I think there's a lot of, I don't know what, so residual, there's probably a name for it, but kind of a residual feeling that people are suffering.
Yeah, so I think that's two-sided, right? I think with our healthcare professionals and those that are you know, have run to the fire, right, who have really ran into to help our veterans with COVID-19, you know, they are tired, right? They are now, you know, starting to take leave, starting to take vacations, starting to rest. And so we're thinking of creative ways to make sure that we're engaging them, that we're honoring them, that we're trying to boost the morale. You know, I think for our veterans, what we're seeing is that, you know, as you do telehealth and you do care by phone, it's not the same, right? And so some things that you may talk to your doctor about in a face-to-face, you wouldn't necessarily bring up on the phone. And so, you know, we are starting to see now more veterans come in who have unnecessarily or so, put their health care kind of on the back burner. And so we are getting prepared for that. You know, we are making sure that we're staffed appropriately for that. We're now transitioning our care to be 70% face-to-face.
Nice.
And then 20% VA Video Connect or virtual, and then 10% phone. So we're trying not to throw the baby out with the bathwater with the innovation, but really turn the system back on to take care of veterans face-to-face. And so it is great to go through some of our buildings and now see more veterans coming in to see that spark, to welcome them back home.
Nice.
But we are prepared to take care of them in ways that we haven't been able to over the last year and a half.
Oh, good, good. And I love the camaraderie whenever I'm with a group of veterans, whether you're in the Army, the Navy, the Marines, the Air Force, what am I forgetting, Coast Guard. You're all good buddies, and you rib each other just like siblings would, but it's all in good nature.
Yeah, absolutely. I think that's one of the reasons that drew me into the VA, right? And so back when I was medically separated in '98, you know, I felt I was lost, right? I started going to a university started a master's program, but I didn't feel that connection, right? That camaraderie, as you mentioned, that feeling of brotherhood or family. And my loved ones around me started to recognize that. They recognized that I wasn't the same person as I was in the military. And had it not been for them seeing that and saying, maybe you should go into the Department of Veterans Affairs, I don't know where I would be today. And so, I've been very fortunate to move up within the system and be a veteran who utilizes the system, right? To be that undercover boss, to be that connection for veterans. And so that's what really makes me proud to be in the department and to really lead the system. I actually can't think of myself anywhere else, to be very honest with you, because I am a veteran who's leading this healthcare system on behalf of our fellow veterans.
Well, I know you work tenaciously, and that's pretty amazing. But I didn't really understand what medically separated means. Is that a term that's specific to something that happened to you that you needed to walk away from the...
Yeah, and I appreciate that. I think I've been very open, when I talk about these things. And right at about the 9-year mark of being in the Air Force, I got really, really sick. In fact, it was about 90 days before I was due to deploy to Iraq. And ended up having a heart attack.
Oh dear.
Right? Ended up being in the hospital for 2 weeks, and then subsequently going to another hospital for 2 weeks to try and figure out what was wrong. And
because you were young, you were very young.
I was young.
Yeah.
I was young.
And it wasn't something that was genetic, or?
No. So what it was is I actually was diagnosed with kidney disease, and so that combination did not allow me to continue my service in the Air Force. And so I think, had it not been for that, I would probably still be in the Air Force today or finishing out a long career. But I'm thankful that happened. And the way I look at things, Kate, is that I see everything as an opportunity.
Absolutely.
Right? So how do we take this moment and make it a more positive one? And I think that's where we need more folks in this world to look at it, right? And to really help us move forward. But because of that opportunity is where I'm sitting today.
Well, good. Well, good. I'm glad that you survived.
Yeah,
I'm glad that they figured out what was wrong with you and that you're able to do as much as you're doing right now. Now, I'm a real strong proponent of creativity and using creativity to heal people as they go through different experiences, and we call it different things at different times. It used to be shell shock, it's PTSD, it's whatever happens after you've been to a war zone or experienced the life of the military. Are there things that we can do to support you from the community, like the creativity level or meeting level? How can we be of more support to you?
Yeah. So I think, as we think about this, right, community support is what veterans need as well, right? So not to be looked upon as someone who was in a war or someone who was, who doesn't necessarily agree or understand, right? Really being that connection, right? Putting that hand out and recognizing, say for instance, suicide, right? What are the signs of suicide, withdrawal, those types of things. And being that advocate for veterans in our community. And I think that's what communities can do to really circle around veterans. And it doesn't go unnoticed, right? Veterans do certainly recognize when their community members reach out, and not just on Veterans Day, where we recognize veterans who are alive, or on Memorial Day, where we recognize those that gave the greatest sacrifice, but throughout the entire year, right? How do we bring forward the skills and the attributes that veterans that they have, right? And I think that when we look at this, veterans probably have some of the best work ethic that anyone has.
They'll be on time.
Exactly. They'll be in time. In fact, before this, I was 15 minutes on time, right?
Yes.
Because that saying, right? If you're not 5 minutes early, you're late.
You're right.
And it's that work ethic that's been ingrained upon veterans that make them such outstanding members of the community. And so it's just recognizing that. And then just really saying, how can we honor them? How can we support them and help them move forward?
I agree. I totally agree. I'm on the Board of Education in town, and I'm always trying to figure out how can we help our veterans through the kids writing letters and doing like a pen pal relationship, or having the veterans come to the school to see the art projects if that's what they're interested in, but having that relationship develop and using those liaisons, because kids need to know that there are older people, the grandparents, parents, if they don't have those people in their lives, life that can be a sounding board for them for different things. Because if you're a veteran, you've experienced a lot, no matter where you've been and no matter what you've done, right?
I agree, and I think a very heartwarming story just from here, in Waterford. We went to one of our vaccine clinics, and it was at Waterford Elementary, and they had all of their students decorate that entire school with mementos thanking the veterans for their service. And you don't see that anymore, right? You don't see that type of connection, but it just means so much. As those brave men and women came in to get their vaccines, they absolutely took notice, right? They absolutely said, wow, this is really, really amazing. And so, how do you do that more, right? How do you take that level of creativity and take it one more step forward? And I'm glad that you mentioned creativity, right? And I kind of like to stick on this topic for a moment because...
we just have a couple minutes.
Oh, sure,
so,
okay.
No, please, but we just have 3 minutes left.
Sure, so I think, doing creative things, what are hobbies that you can integrate in for veterans, whether it be beekeeping, right? I've seen amazing stories of veterans attending to bees and working in apiaries where they have PTSD, that they've been able to focus and it helps with their mental health.
Exactly.
And so how do you take that, right, and put it into the community, invite veterans in? So really kind of exciting things that I think veterans appreciate.
Well, I'm really into keeping or logging people's stories, getting people to tell their stories and share their stories. And my feeling is that once you've told your story, then if it's a hard, heavy story, that's lifted out of you and you feel better. So I've had several veterans on my show, and I really like to hear veterans. So if there are any veterans who would like to be on my show, I'd love to have them tell. And also I'm trying to do story writing in the community, getting people to tell their stories. And I like to do painting too, that kind of thing. So any of those kinds of things I think really, like you said, get you out of whatever your past might have been and focusing on, like you said, the bees and how they can be safe and preserving life for them.
Yeah, and I would say, I also encourage, as I mentioned, for veterans to reach out to me, right? And so I appreciate you having them on your show. Again, my number is 203-500-2983. I'm happy to be that conduit between the department, as sometimes it seems such a large system, right? How do you have that one person who can help break the ice and help build that connection for you? And I think that's important, so I'm happy to help.
Well, you're doing it. So thank you again. Thank you so much for all of the work that you're doing, for the services that you're providing, for that bright, shiny face that's out there welcoming people and saying, here's my number, give me a call, and saving lives. Saving lives. You do a lot, so I really appreciate your being here.
Thank you. And we appreciate your support.
Oh, always. You always have my support, so thank you so much.
All right.